name's Nicole. I'm going to be your student nurse this evening. I'm going to go ahead and close this door for a little privacy here and perform some hand hygiene. What's your full name and date of birth?
Lisa Beach, 7/21/87.
Perfect, Lisa. And can I go ahead and check that against this? All right, that looks good. And what do you prefer to call?
Lisa.
Lisa works. All right, Lisa, so what we're going to be doing is performing a head-to-toe examination today. I'm going to record all my findings in your electronic medical record. Are you comfortable where you're at?
I am.
Okay, great. And I'm just going to check the room for a few safety items here before we move on, okay?
Okay.
All right, looks like all your side rails are up. Your bed is lowered all the way down, and it is locked. Okay. It looks like on my wall here I have my ambu bag on the side. I'm going to come over here and check this suction. Alright, so my suction works, and I have a yanker and a canister here. I have my oxygen with my Christmas tree on the wall here as well. Looks like I have gloves that fit me as well as a sharps container. My floor is nice and clear with no debris. I have my trash can here, as well as my linen bag and a biohazard bag as well. All right, we are going to go ahead and get started. I'm just going to ask you a few questions first. Do you have any allergies to any medications?
No.
Anything else?
No.
And any medical history I should know about?
No.
Any surgical history I should know about?
No.
Okay, and then I'm just going to ask you a few more questions. I ask everybody. Just answer these to the best of your ability. Do you use any illicit drugs?
No.
Any alcohol?
No.
Any marijuana of any kind?
No.
Any tobacco in any form?
No.
Okay, great. Are you having any pain today?
I am having some lower back pain.
Okay, and what makes that pain better?
Rest.
Okay, and what makes it worse?
Bending over.
All right, I'm sorry to hear that. And with that pain, would you say it's achy? Does it feel tight? Is it sharp?
It's achy.
Achy, okay. And does it radiate? Does it go to any other parts of your body?
It doesn't radiate.
Okay. And on a scale of 0 to 10, 0 being no pain, 10 being the worst that you could ever feel, why would you rate that pain?
About a 3.
Okay. And how long has this been going on?
It started like 2 days ago.
Okay. Does it come and go?
It does come and go.
All right. Sorry to hear that. What do you think happened?
I think I hurt myself lifting a heavy box.
Gotcha. Okay. Just really quickly, we're going to move on. You know how to use the call light, correct?
Yeah, press this orange button here.
Okay, yeah, just press that anytime you need me or you want to get up for any reason.
Okay.
Okay, so first we're going to start with your neurological exam.
Okay.
Can you tell me, have you had any dizziness or anything?
No.
Any trouble balancing, any headaches?
No.
Okay. And I'm just going to ask you a few more questions. Just answer to the best of your ability. What's your full name?
Lisa Beach.
Okay. And where are we?
We're at school in the CEC.
Okay. And why are we here?
To do a head-to-toe assessment and for my back pain.
Okay. And what is today's date?
6/21/22.
Okay, close. All right, so patient is alert, awake, and oriented ×4. So really quickly, I'm just going to shine my light in your eyes really quick and just check your pupils, okay? I'm going to do it twice in each eye.
Okay.
All right, pupils are equal and round with response to, responsive to direct and consensual light. All right, Lisa, I'm going to go ahead and move on to your head, ears, eyes, nose, and throat. I'm sorry, have you had any trouble swallowing recently?
I haven't.
No, okay, great. So now we're going to move on to your head, eyes, ears, nose, and throat area, okay? Now, have you had any drainage from your mouth for any reason?
No.
All right, any drainage from your nose or ears?
No.
Okay, great. I'm going to go ahead and just shine a light on the sides of your eyes.
Okay.
Okay. All right. Cornea looks clear and shiny. Can you pull your lower lids down for me? Great. Conjunctiva looks pink and moist. Sclera is white and clear. And then can you go ahead and pull your mask down and open your mouth for me? All right. Buccal mucosa looks pink and moist with no lesions. Gums are pink and moist with no lesions as well. There is no bleeding. And teeth are white aligned and I see no evidence of decay. I'm gonna go ahead and perform a hearing test next. So what I'm gonna have you do is cover your other ear on this side. I'm gonna whisper 3 things in your ear and just repeat them back to me, okay?
8-4C.
Okay. And if you'll cover your other ear, I'm gonna whisper again.
C6B.
Great, so hearing is clear bilaterally with no deficits, so everything looks good there. We're gonna go ahead and move on to your pulmonary system, okay? If you'll just lift your neck for me, trachea is midline. Have you had any trouble breathing recently?
No.
Any shortness of breath?
No.
Okay, great. And what I'm gonna do here is I'm just going to listen to some lung sounds, and we're going to talk about that. And then I'm also going to view your chest. So, upon inspection of your chest, looks like there's even unlabored breathing. Chest is symmetrical, and I see no evidence of barrel chesting. All right, so if you'll sit up for me, we're gonna start with your back, and I'm just gonna have you cross your arms in front and kind of lean forward a little here. Perfect. Thank you so much. And I am gonna move your shirt a little bit. Is that okay?
Yeah.
Okay. I'm gonna lift your shirt from the bottom here. Is that okay?
Yeah.
Alright, lung sounds are clear and equal bilaterally. Oh, I apologize. I'm going to check your sides and your front as well. Okay, if you'll lift your left arm for me. Okay, I'm going to move to your right. Okay, and now we're going to do your front. Just 4 spots on the front, okay? Great. Lung sounds are clear and equal bilaterally. Okay, I'm going to move on to your cardiac assessment here. So have you been having any chest pain?
No.
No palpitations or fluttering?
No.
Okay, so what I'm going to have you do is just lay back. Thank you. I'm going to assess your apical pulse. So that's located at your 5th intercostal space at your left midclavicular line. It's going to be right under your left breast. In just a moment, I'll have you lift that up for me with the back of your hand, okay?
Okay.
Okay, I'm going to move your shirt, and if you'll just displace your breast tissue with the back of your hand. Alright, I did hear S1 and S2. I heard no murmurs, rubs, or gallops, and your apical rate was 78. Alright, Lisa? I'm going to go ahead and move on to your abdomen here. So what I'm going to have you do is just kind of place your shorts a little bit lower. There we go. And then just your shirt kind of right where it's at is perfect. Alright, thank you so much. Have you had any blood in your stool or anything?
No.
Okay, great. And then when was your last bowel movement?
This morning.
Okay. I'm just going to palpate this area. You just let me know if you feel any tenderness, okay? Okay. All right, great. Upon palpation, no masses felt and no tenderness as well. Abdomen is soft. And then since you're laying back, I'm just gonna lower this a little bit so I can see the contour of your stomach. Sound good?
Okay.
Okay. Perfect. I'm gonna go ahead and perform a little hand hygiene since I touched the bed here. All right, and upon inspection, see the contour of the stomach is flat and umbilicus is midline, okay? I'm gonna go ahead and listen to your bowel sounds. So I'm gonna do it in the same 4 spots that I palpated just a moment ago. Just breathe normally and everything for me. And I'm gonna use my bell here so I can get a better sound. Great. Normal active bowel sounds are heard in all 4 quadrants. All right, so I'm just gonna ask you a few questions. Feel free to pull your shirt back down and your shorts back up if that makes you comfortable. Are you still comfortable in bed, or would you like me to lift it?
Yeah, I'm okay, thank you.
Okay, great. And now, have you had any urine in your, blood in your urine recently?
No.
No? Okay, and any pain while urinating?
No.
Okay, sounds good. So next I'm just gonna move on to your upper and lower extremities, okay? So I'm gonna start with your arms. Have you had any numbness in your arms?
No.
Any tingling in your fingers?
No.
Okay, great. If you'll just pull your hands out from under you there. All right, what I'm gonna do is I'm just gonna palpate down your arms, and you let me know if the sensation feels equal on both sides.
Okay.
Okay.
Yeah.
Okay, great. Sensation is present and equal on both sides. I'm gonna go ahead and take your radial pulse, so if you'll just turn your hands out for me. I'm gonna do that on both sides at the same time. Alright, pulse is equal bilaterally, 2+. And then I'm just going to go ahead and check your capillary refill here on your fingertips. So I'm going to squeeze your fingertip and just check. Alright, capillary refill is under 2 seconds, so that looks great. I'm going to hold my hands over you. What I want you to do is lift your arms and then grab my fingers and squeeze as hard as you can, okay? Alright, great. So muscles, strength is a 5 out of 5, full range of motion, okay? Skin is warm and dry. I see no evidence of unusual color for your ethnicity. No lesions, as well as no edema was palpated, okay? I'm gonna go ahead and check your your legs. And I'm gonna do the same thing I did to your arms. I'm just gonna palpate down your legs. Let me know if you can feel that equally, okay?
Yeah.
Feel good? All right, great. So sensation is felt equally on both sides. Skin is warm and dry with no evidence of lesions. Color looks normal for your ethnicity. And I felt no edema. So now I'm going to just check your pulses on your feet here. So the first thing we're going to check is your dorsalis pedis pulse. That's going to be at the top of your foot, okay? Just going to do that on both sides at once. Okay. Pulse is equal bilaterally, 2+. And then I'm going to go ahead and check in the back. This is your posterior tibialis, okay? All right, pulse is 2+ and equal bilaterally there. Now I'm going to check your capillary refill, just the same thing I did with your fingers. I'm going to pinch your toe real quick. All right, capillary refill is under 2 seconds, so that looks good as well. And then I'm just going to do a strength chest check. Just push your feet as hard as you can against my hands. All right, now bring your nose to your toes to your nose. All right, muscle strength looks like a 5 out of 5 there as well. I'm gonna go ahead and perform some hand hygiene since I've touched your feet. And then just on your skin here, have you noticed any lesions or skin breakdown?
No.
No, okay, no masses or anything or unusual moles?
No.
Okay, great. Upon inspection, I've been doing this during the entire assessment. I've noticed that your skin is warm and dry. The color looks normal for your ethnicity. I've seen no lesions and no edema has been felt. The temperature is normal. It looks like everything is good here, Lisa. I am going to finish up my exam and I will record everything in your electronic medical record. Are you comfortable where you're at, or would you like me to move the bed?
No, I'm okay.
Okay, great. And I have the call light here. Do you remember how to use that?
Yeah, the orange button here.
All right, looks good. So hit that if you need me at any point. I'm going to head out. All right,
Thank
thanks.
you.